As the CCG responsible for commissioning NHS services in the coastal West Sussex area, it's our job to make sure that the services we have in place already are working and to help make plans for the future. We help decide which NHS services get funding and how much funding they'll need to get the best health outcomes for our population, and we want to change how that happens. I know this sounds like it could be a bit dull, but keep listening because it gets interesting, and if we want a healthy population with easy access to the right healthcare for everyone, it's also really important. Right now, service providers, the people who run hospitals and provide services in the community, can feel that they compete with each other for our attention and funding. Every year, they let us know how much they think they are going to spend. We discuss with them how many operations they plan on doing, how many medicines they'll prescribe, the number of babies they'll birth or broken bones they'll mend, or just the total amount of money they'll need to keep going for another year. Each individual unit, specialisation and department is competing for a piece of our NHS funding pie. While this is very flattering for us, there are some problems with the current system. Firstly, there's no incentive to be doing less treatments, so no incentive to keep people well. And secondly, in order to preserve their bit of the budget, departments sometimes argue about whose responsibility a particular patient is. Not just within hospitals and primary care, but also in terms of social care, where things can get even messier. We can forget that we're all on the same side, and that we all have the same mission to get and keep people healthy, happy and well. For doctors, nurses and other practitioners, this political infighting is frustrating. For patients who don't know which department deals with their particular needs, finding the right department can be maddening. Imagine you're a patient with a mental and a physical illness, perhaps even more than one illness. You may be rejected from some of the care you need because another one of your ailments is seen as more urgent. Or worse, your care may be delayed while departments face confusion over whose responsibility you are. Having several things wrong with you is something we have to deal with more often as our population gets older. And with a predicted funding gap, as well as cuts to social care putting increasing pressure on the overall NHS budget, we simply cannot afford to waste time squabbling internally while our patients suffer and their symptoms progress. To find a better way, we launched the embarrassingly named Let's Talk campaign. We've spent the last 3 years talking to people, patients and healthcare professionals. We've found that there's been a movement growing within the NHS towards integrated care. Integrated care means caring for people as a whole, rather than separating them out into their problems and conditions. It means looking at the health of whole communities, rather than just the sick people within them. It's about dealing with how one condition impacts another and treating them all at the same time. It's about how preventing illness before it takes hold is just as important as curing it. This is sometimes seen as hopelessly idealistic, but we don't think it is. We heard about great systems in the United States, in Spain and New Zealand, so in addition to the Let's Talk campaign, we studied those as well. And now, having done our research, we are ready to make a few changes. What we want to do is work with healthcare providers that can show us that they have integrated care in mind. Providers willing to work in different ways together, that have shown that they know the specific issues which affect the communities on the Sussex coast and have a joined-up plan to tackle them. From now until 2020, we're going to be doing this more and more. But in the run-up to 2017, our particular focus will be in 2 key areas: integrating GP care with community services and transforming urgent care. We want to look at patient flow, stripping away organisational barriers so that the entire patient pathway can be covered under a single budget. We want to provide incentives based on patients getting well rather than the number of times they are seen, so that each of the departments they pass through is taking some responsibility for their overall journey. We're going to look at what people do when they start to feel ill or have an accident, and how to decide who is the best person to treat them, redesigning the front door to make it easier and faster to get where you need to be, So that utopian dream of each patient getting the right care in the right place first time every time can take another small step or giant leap towards becoming a reality. We also want to look at GPs because this is where 90% of patient interaction takes place. We want to work with GPs who are able to network and partner with existing community services to generate and promote health. We want to find ways to use new technology to group patients differently and identify and tackle health risks before they become health problems. We want to work with them to plan and combine individual specialisms into multidisciplinary primary care teams. We want to see them partnering with housing associations, mental health provision or charities. We want to see how working with their communities can counteract the negative effect that social isolation or depression can have on chronic conditions. Basically, we want to see a change. And it may sound a little daunting. It may be tricky to set up, but that's okay. We are prepared to work hard. For 3 years, we've listened to what you want, and now we want to give it to you. We think that by doing this, we will save money in the long term, that we will make the lives of health professionals more rewarding and ultimately lead to much healthier people living in healthier communities across the West Sussex coast. So if you are interested in working together for one NHS, start believing that integrated care can work, because in many places it already is. If you're involved in local health and care, start working as one now, and together we will make it happen.